Like, do you ask the question specifically, or can I just talk to it in general?
You can just talk to it in general. I mean, we try and keep it in order so we can organize it, but it all blends
Because I
in.
feel like they all kind of like go together.
It's like, how do you handle it? How do you come together as a team? And what advice would you give to others, in the same, in prevention?
Okay.
So, and that's where we start.
So I could just start talking?
Yeah, so what are you doing personally?
So us as a bedside nurse?
Yeah, she was a bedside nurse to keep patients safe from cause.
So if my patient has a Foley, which he does today, I would do meticulous Foley care, every couple hours. And then we also, with the breathing tubes, every time you suction, you want to make sure that you clear it with, sterile water afterwards. Keep the head of the bed up if you can, and do meticulous mouth care.
That's excellent. So, and...
but there's a lot of editing going on here.
Oh, yeah. We'll pick
Can
up
you slim
pieces.
me out a little bit? Just kidding, kind of.
So to get to where you guys are now, I mean, great successes we see here. So, as a team, how do you maintain that? And how'd you get to that point?
So I've been here for like 12 years now. So when I first started working here, we didn't talk about any of this kind of stuff. So I think a lot of it has just been discussion and trying to figure out what works and what doesn't work. So a lot of like research type stuff goes into it. And then the bundles that we created have been super helpful. So, if you just do what it says, you pretty much are doing the prevention piece of it that you need to do, right?
Where do you find there's some challenges?
I find challenges sometimes in when you're rushing to do things and you don't always do all the steps that you need to do, or if you have maybe people that have worked here longer and they feel like they know a better way to do it than you do, that might not be the way that we want people to do it.
So how do you overcome that?
So I feel like giving in-time feedback is really, really good. So if I witness it, or if somebody comes directly to me, I find that going to that person right then and there. Like we had a situation where we have changed our policy that putting in a Foley is a 2-person job now. So this person was doing it by herself. So after that, I gave her feedback into why that wasn't the best way to do it, and that she next time needs to have a second person there, basically. But I mean, and I couldn't understand why she didn't do it. But she said, well, it was a bigger kid and I didn't think I needed a second person. But that's not a good reason, if you know what I mean.
I do. So that's good, because that's great feedback and coaching.
Yeah.
And,
I think the tough thing is that if you don't have that comfort level of your own, I wouldn't say expertise, but I feel like I know what I'm doing here, so it's easy for me to but give somebody feedback, like, hey, I know that what you're doing works, but we should really be doing it this way,
right,
just because it's safer for the patient.
That's fantastic.
Yeah. I find that if you always bring it back to the patient, you can never go wrong, right? So no matter what I say or how I say it, if I point to the patient, then it's always right.
Absolutely. That's great advice right there.
Right?
Because, circling back to the patient. Yeah,
no, but that's what I do with everything. Like, even with families and stuff, sometimes if they're doing too much touching or agitating the baby or something like that, it's like, I don't want to tell a parent not to touch their child, but what you say is, sometimes less is more. And right now, they don't need a lot of stimulation. So this is for them. I'm not saying you can't talk to them or touch them, but best for them if you just step back. And they're always receptive to that if you make it about the kid,
I love it. That's a new angle for the family.
Sweet.
I love.
Sweet.
So true. I
Cool.
love that. How do you, speaking of the family, so how do you partner with them specifically around preventing infections for your patients?
In the ICU, it's tough because so many of our kids are so sick that the family doesn't have a lot. Not that they don't have input, but they sometimes don't have the education behind what we do. So I find that just explaining to them why you do something is usually just enough to get them on board with everything. The other thing we do pretty well here in the ICU of late, pretty recently, is on rounds every day we talk about, do we need the Foley? What's the plan on getting the breathing tube out? We really try not to leave things in any longer than we absolutely have to. So, and that's a huge change. Because 10 years ago, these kids would have Foleys for weeks, and it was not unheard of.
Is it clear, the process for making that determination?
It is. Every day we talk about it on rounds. It's a specific question. Do we need this Foley or don't we need the Foley? And if we do, what's the rationale for keeping it? Right? And 9 times out of 10, you won't have a Foley. Is it easier for us? Of course. You change less diapers, right? But it's not about us.
Yeah.
What does it mean to you to be, I'm going totally off script.
Sure.
What does it mean to you to be a highly reliable unit when it comes to preventing harm for your patients?
Well, I think it just goes to show that we've done a lot of work in the past couple of years to like make the changes that we need to do to keep the kids safer. I mean, I know that it's tougher here with like our central lines and stuff like that, just, that's a big thing. We see so many more of them than say like the CCU, so, but like we've also done a ton of work around that kind of stuff. I mean, where, decades ago it wasn't unheard of for these kids to have line infections after line infection and after line infection, you know what I mean? So, and I also don't think that people appreciate how sick these kids get from something that you or I would kind of like cough at, right? And we've seen it, like it can kill these kids. So I feel like if you, not to be like dramatic, but if you make people understand the severity of what happens, I think they're more apt to do the policies or the procedures or whatever you recommend. So.
Phenomenal. Yeah.
Do you coach and mentor newer staff, and how would you do that in harm prevention?
It's not like we have a specific coach that does that, but through their orientation and then their post-orientation, they work with something called a CRN, which is like a resource nurse that they can go to for like their first 6 weeks off orientation. And I feel like a lot of that kind of stuff gets involved in like the post-orientation stuff as well. But as a preceptor, I should say, precepting a new person, I feel like you always go through all of that and what's most important. Because these infections are, I feel like with the changes in healthcare, they're so much bigger than they used to be, right?
Yeah.
So, unfortunately, everything's about money now.
Well, given what you're saying, because you've been doing this a long time, your unit's been focused on this for a long time. So, another unit who wants to see improvement, and they want to see it fast, which might not be. So where would you advise them to start? Like, what's
definitely
the best
the bundles. And then I also think that you have to get your more senior staff on board with what you're trying to do, because that is where I find that because the newer staff look up to them, right? And they don't want to feel less, or they don't want them to think, they're not a team player or something if they're going to go and tell them. So I think like having more senior staff on board is super important too. And not be judgmental about people when they might not know what to do. Because I feel like sometimes we're not as forgiving as nurses. Like we're all on the same team. Sometimes we forget that. So, but I also think like using the bundles have been great. Like we've shown that they work. So that would be my first thing for like a new unit. And then the in-time feedback is also very important. Like you have to feel comfortable saying to somebody like, I get that was the old way that we used to do it, but this is what we're doing now. And it's not like a choice. Like this is what we're doing, or else you don't have a job. Like, I don't mean to be again that dramatic, but you almost feel like you have to do that sometimes with people. So.
Well, it shows that there needs to be a level of accountability and responsibility,
Yeah.
and that just seems indicative of the job.
Well, and then also making it about the patient, right?
Right.
Yeah.
And that's I love
the key.
that.
That's the key. Yeah.
That's more like a big arrow.
Pretty sure
circle.
that's going to be in the video, right?
Yes.
Yeah, it definitely will be. Your comments about high reliability and the way we do things, that is high reliability.
Yeah.
This is the culture and how we approach care. And sometimes it actually doesn't even feel special anymore.
Right.
Right?
No, I agree.
Like we went to a unit that hasn't had a VAP in like 4 years. And we want to celebrate success there. And they're like, what success? What are you
right.
Like,
you don't even realize that you're doing
right,
such a good job.
Exactly. And it's just, no, that's just how that's how we perform, and that's highly reliable.
Yeah.
So
no, I agree.
Powerful.
I agree.
But
I think we do pretty good work here.
Oh, absolutely. Otherwise, we wouldn't be here.
That's why we're recognizing you.
That was a lot easier than asking the questions.
Yeah.
See,
Yeah.
well,
So you
thank you
can free
so.
talk a
I
little
think
bit.
we
Yeah.
got
Thank
so
you